An intradermal injection is given into the dermal layer of the skin at an angle almost parallel to the skin. Intradermal injection sites are areas where the skin is thin, such as the anterior forearm, the middle of the back, or the upper arm. The most frequent use of intradermal injections is to administer a skin test, such as intradermal allergy tests or a Mantoux tuberculin test. The needle used for an intradermal injection is short and ranges from 3/8 of an inch to 5/8 of an inch long. The lumen of the needle has a small diameter with a gauge ranging between 25 and 27. The physician has asked the medical assistant to administer a Mantoux tuberculin test to a patient as part of an employment physical examination. To prepare the injection for a Mantoux tuberculin test, first sanitize your hands and assemble your supplies. You will need the Mantoux PPD tuberculin solution, a tuberculin syringe with a short needle, and an antiseptic wipe. The Mantoux test requires that 1/10 milliliter of PPD solution be administered intradermally to the patient. Draw this amount into your syringe. It is important to draw up the proper amount of tuberculin solution. Injecting too much of the solution might elicit a reaction not caused by a tuberculous infection. Injecting too little of the solution results in insufficient solution being injected into the skin to elicit a reaction. Once you have prepared the medication, place the syringe on a tray along with an antiseptic wipe and a gauze pad. Greet the patient and introduce yourself.
Hi, I'm Diana.
Identify the patient by full name and date of birth and explain the procedure and purpose of the injection.
The doctor wants to give you a TB injection as part of your physical exam. Okay.
Select an appropriate injection site. Use the anterior forearm approximately 4 inches below the bend in the elbow. Avoid hairy areas of the skin, areas with visible veins, scar tissue, red or swollen areas, bruised areas, and areas with dermatitis or other skin irritations. These areas make the test harder to perform and interfere with good visualization and palpation of the test reaction. Prepare the injection site. Cleanse the area with an antiseptic wipe using a circular motion, starting at the injection site and moving outward. Do not touch the site after cleansing it. Allow the area to dry completely. If the antiseptic is still wet when the skin is punctured, the patient experiences a stinging sensation. In addition, the antiseptic may cause a reaction that could be mistaken for a positive test result. Apply gloves and remove the needle guard. With the non-dominant hand, stretch the skin taut. This permits easier insertion of the needle. Insert the needle at a 10 to 15 degree angle, almost parallel to the skin, with the bevel upward. This ensures that a wheal will be formed during injection. The needle should be inserted about 1/8 of an inch until the bevel of the needle just penetrates the skin. Slight resistance may be felt as the needle is inserted. No aspiration is needed. Hold the syringe steady and inject the medication slowly and steadily by depressing the plunger. As you inject the medication, a firm, tense white wheal forms. Test results are considered reliable only if a wheal forms. Expect to feel a certain amount of resistance as you inject the medication. This indicates that the needle is properly located in the superficial skin layers rather than in the deeper subcutaneous tissue. If a wheal does not form, repeat the test at a site at least 2 inches away from the first test site. Place the gauze pad over the injection site and quickly remove the needle, keeping it at the same angle for insertion. Do not apply pressure to the injection site. Applying pressure may cause leakage of the testing solution through the needle puncture site, resulting in inaccurate test results. If blood appears at the puncture site, it is not significant and will not interfere with the test results. Activate the safety shield on the needle. Properly dispose of the needle and syringe in a biohazard sharps container. Remove your gloves and sanitize your hands. Stay with the patient to ensure that she is not experiencing any unusual reactions. Instruct the patient in the care of the test site. Tell her to continue normal daily personal hygiene activities such as showering or bathing, not to cover the test site with a Band-Aid, avoid the use of ointments, lotions, and sunscreens, and to pat the arm dry after washing it rather than rubbing it dry. Tell the patient not to touch, scratch, press on, or rub the test site because this can alter the test results. Inform the patient of the date and time to return to the medical office to have the results read. Results must be read within 48 to 72 hours after the test has been administered. Stress the importance of returning to the office to have the results read, even if the test site does not exhibit a reaction. If the patient does not return, the test must be repeated. Chart the procedure, include the date and time, the name of the medication, the dosage given, the manufacturer and lot number, the route of administration, the injection site used, any significant observations or patient reactions, and instructions relayed to the patient. The medical assistant will now show you how to read and interpret the MAN2 tuberculin test results. Greet the patient and introduce yourself. Identify the patient and explain the procedure. Work in a quiet, well-lit environment. Check the patient's chart to determine which arm was used to administer the test. Sanitize your hands and apply gloves. Have the patient flex the arm at the elbow. Locate the application site. The results should be read horizontally to the long axis of the forearm, meaning across the forearm. Gently rub your finger over the test site and lightly palpate for the presence of induration. If induration is present, the area should be lightly rubbed from the area of normal skin without induration to the indurated area to assess the size of the area of induration. Induration is the only criterion used in determining a positive reaction. If erythema or redness is present without induration, the results are interpreted as negative. As you can see, Audrey has a negative reaction to the tuberculin test, but let's look at other reactions that have induration present. When induration is present, you must measure the induration with a millimeter ruler, which is supplied by the manufacturer. The induration with this reaction measures 5 millimeters. The induration with this reaction measures 10 millimeters. The induration with this reaction measures 15 millimeters. Remove your gloves and sanitize your hands. Chart the results. Include the date and time, the name of the test, which is MAN2, the brand name of the medication, which is Tubersol, and the test results recorded in millimeters. Since Audrey had no induration, 0 millimeters is recorded. Complete a tuberculin test record card and give it to the patient. The record card provides the patient with a permanent record of the test results.